So hey guys, my name is Kristen Pugh, and for my topic I got birth control methods. So I'll be talking about all the common types of birth control, which the 7 I chose was IUD, vaginal ring, the pill, the patch, the implant, burial methods, and the shot. So I'm going to go into detail discussing every one so you can get a better understanding. Birth control is a very common method of preventing pregnancy. A bunch of girls, typically my age, use it throughout college when you don't want kids, and some people even have it for medical uses to help get their cycle on track and to help them throughout their menstrual cycle and through puberty. So the first one I'm going to talk about is the pill. The pill is 91% effective usually. There's different brands that you can get. Usually you have to see your doctor to get a prescription. You take one every morning, and usually the doctor recommends if you take one at 6 a.m., you take the rest of them for 6 a.m. because it's always great to be on that schedule and never miss one, because if you miss one, then your percent of it being effective goes up and is differently from a person that typically takes theirs every day. It is very, very important that you take it every day, because then obviously it will not work. You take one every day, and usually at the bottom of the pill it's a different color, and that is for your menstrual cycle, for it to still be on track too. The next one I'm going to talk about is the vaginal ring. The vaginal ring is usually a small piece of plastic about this size, usually, and it's flexible. You usually squeeze it and stick it inside you. And this is something that you can do at home. Usually you keep it in for 3 weeks and you take it out for the last week for your menstrual cycle. A lot of people actually use this birth control, and it has been 91% proven effective. It is always just very important when you're using birth control, and especially birth control that you stick inside you or it goes somewhere in your body, that you use it properly. So if it tells you to take it out for a week every month and only have it in for 3 weeks, it's very important for you to do that, because there has been cases where people leave it in for a very long time when it's not supposed to. Stuff can start going bad, like stuff growing around it, you can't get it out. You have to have surgery, so it's very important to always follow the instructions. The next one I'm going to talk about is the patch. The patch is usually like a square little bandage, and you can usually put it on your hip or your arm, and it just releases those hormones to prevent pregnancy. It's usually like a beige skin color. It just looks like a normal band-aid, and it just releases those hormones to prevent pregnancy. It's 91% effective. You can get one as a prescription from your doctor, and you just pick it up at your pharmacy and you just use it to prevent it. And it's the same kind of like the ring. You use it for 21 days, take it off the last week to still have that menstrual cycle. So the next one I'm going to talk about is going to be burial methods, which this is like a very common one that I feel like a lot of people have heard of. The burial methods are a little different from each of the other ones that I'm going to talk about, because burial methods prevent the egg from actually fertilizing or going to that sperm during sexual intercourse. So it is something that happens usually, it's only used like during sexual intercourse. So burial methods are like the cervical caps or condoms. So a lot of people have heard of them, and they're usually about 99% effective if you use them correctly. Next one I'm going to talk about is IUD, which has 2 different brands, either copper or plastic. And the 2 different brands are just the one that you choose. You can get it from your doctor. They're usually 99% effective, and they go inside you. But as always, you need to be careful about how you remove it. Make sure you remove it on time. Make sure you consult your doctor on if it's safe for you to use it, because all these birth controls have different side effects for different people. So it's always important to make sure you find the one that works best for you. So the IUD, you can get different brands that last to a different length, usually the 3 to 7 years. So a lot of people actually prefer this one because you can just stick it inside you, the doctor can put it inside you, and you don't know it's there, and it actually lasts for a very long time compared to you like having to take the pill every day. So this one's very, very common, and it actually lasts for a long time. So people actually like it because it's very convenient. And the last one I'm going to talk about is the shot. The shot is 94% effective. You can actually give this shot to yourself at home or have your doctor give it to you in the clinic. It's just a shot that goes in your arm, and you just releases the hormones just to prevent pregnancy. It's just like a typical shot you would get for any other thing. And the last one I'm going to talk about is the implant, which is 99% effective. You have to go in for a doctor to put it in you. They usually just cut your arm, stick it inside you. It's a little bitty, small rod that just sits there and releases those hormones. And usually it's like a 4-year thing. After they put it in, it'll last for 4 years. You come back after the 4 years, you can get a new one. Or at any time, if any birth control is usually not working out for you, you usually can consult your doctor and they can figure out to change it to make which one is best for you. So I'm going to bring it in a little closer so y'all can see all the pictures that were shown. Hope y'all enjoyed this, and I hope this was very informational for you to learn the birth control methods.